Hemophilia. What is hemophilia? Hemo means blood flow, and philia means love or tendency to. They have Greek roots, and the name love of blood came around in a medical treatise in 1823, and essentially means the constant flow of blood. Hemophilia is a bleeding disorder that slows the blood clotting process, resulting in excessive bleeding, thus where it got its name. It occurs in the factor VIII protein, which is the protein that controls blood clotting. Hemophilia A and B are the two types of hemophilia. Hemophilia A is known as the classic hemophilia or factor VIII deficiency, while hemophilia B is known as the Christmas disease, named after its first patient, Stephen Christmas, in 1965.
There are two types of hemophilia, A and B. In hemophilia A, it affects 1 in 5,000 males. The characteristics of the missing clotting factor, which is basically what is causing the blood not to clot, is the cofactor. The cofactor is a non-protein chemical compound or metallic ion that is required for an enzyme's role as a catalyst. The molecular weight, which is the ratio of the average mass of one molecule of an element or compound to 1/12 of the mass of an atom of carbon-12, is 280 kDa. And the normal concentration in plasma, which refers to the concentration of an agent in the plasma, which is derived from full blood, is 0.1 to 0.25 Ug/ml.
Hemophilia B affects 1 out of 30,000 males. The characteristics of missing clotting factors in hemophilia B are enzymes, which the molecular weight is 55 kDa. The normal concentration in plasma is 3 to 5 Ug/ml.
The similarities between hemophilia A and hemophilia B are that they're both X-linked recessive genes, and they both lead to joint bleeding, muscle hematoma, soft tissue bleeding.
What are the symptoms of hemophilia? After a surgery, there will be excessive bleeding that cannot stop. In some bad cases, there will be internal bleeding into the joints, muscles, brains, and other internal organs. Bleeding into the brain can lead to other medical issues like throwing up, strokes, and severe pain in joints. One may become very easily bruised and sometimes may not know where the bruising came from. As well as internal bleeding, there will also be bleeding in soft tissues that can cause nerve damage. Diagnosis. For some people, it will not be known that they have hemophilia until they have surgery or injury that result in unstoppable bleeding. For others, it may be discovered in the first 3 to 5 years of their life. A factor VIII activity blood test lets doctors see how well a protein called factor VIII is working. The body's clotting factors are numbered using the Roman numerals I through XIII. They work together in a special order, almost like pieces of a puzzle. Genetic testing is also available for the factor VIII gene and the factor IX gene. Genetic testing for factor VIII gene finds a disease-causing mutation in up to 98% of individuals who have hemophilia A. Genetic testing of factor IX gene finds disease-causing mutations in more than 99% of individuals who have hemophilia B. Frequency. Hemophilia is more common in males than females. Hemophilia A is the most common type of condition. 1 in 4,000 to 1 in 5,000 males worldwide are born with this disorder. Hemophilia B occurs in approximately 1 in 20,000 newborn males worldwide. The picture explains the percentage of children 2 years and less likelihood of being diagnosed with hemophilia can be detected in babies. 2.8% before the baby is even born, 4.7% in the first 12 to 24 months, 7.1% in the first 7 to 12 months, 15.6% in 1 to 6 months, and 69.7% when the baby is less than 1 month old.
Pattern of inheritance. Both A and B strands are inherited in an X-linked recessive pattern, which is an X-linked recessive gene. This diagram shows why this mutation usually only affects men, because men only have one X chromosome while women have 2. This is why men become symptomatic and women are carriers. However, according to Medical Plus, 10% of female carriers have half the normal amount of blood clotting, so they are most at risk when injured or on their menstrual cycles, or even during surgery. These mutated genes are in the F8 gene and the F9 gene, which is talked more about in causes. These are somewhat common mutations results of inversion and crossing over during meiosis.
We know the gene that's affected is F8 and F9 and which strands it changes, but the F8 and F9 encode for coagulation factor VIII and FIX, and mutations in these genes are the genetic basis of hemophilia A and B. Mutations. Some of the mutations that cause this disease is point mutations, deletion, insertion, or the most common, which is inversion. Mutations in the FVIII gene cause hemophilia A. Mutations in the FIX gene cause hemophilia B. In the image, you could see substitution, mutations, insertion, and deletion. Affected gene. The chromosome that the gene is affected by is located on the X chromosome. Since males inherit only one copy of the X chromosome, if that chromosome carries the mutated gene, then they will have the disease. But since females have two, it's usually less severe or common for females to get hemophilia. Protein. The F8 gene provides instructions for making a protein called coagulation factor VIII. A related protein, coagulation factor IX, is produced from the F9 gene. Mutations in the F8 or F9 gene lead to the production of an abnormal version of coagulation factor VIII or coagulation factor IX, or reduce the amount of one of these proteins. Coagulation factors are a group of related proteins that are essential for the formation of blood clots and help control bleeding. The images on the right shows F8 and the image on the left shows F9. F8 and F9 genes. On the charts, you could see that there is no amino acid sequence change on the non-pathogenic part of the chart, but there is on the pathogenic parts. This shows that non-pathogenic does not cause disease, meaning there's no effect and no amino acid sequence change, while pathogenic causes a change in the amino acid sequence and causes disease such as hemophilia.
Treatments and prognosis options. There's no cure for hemophilia, but there are some treatments. Treatments are based on severity and can be lifelong. For simple cuts and scrapes, gauze and band-aids are needed. However, when they are more severe, treatments vary. Treatment 1 is an injection into the bloodstream and have to be continuous. Same with physical therapy, which is treatment 2, so the joints don't tear and damage. However, when joints tear and damage, treatment 3 is needed, which is an artificial joint. On the upside, scientists are creating a gene replacement treatment for hemophilia A, and the results are positive. But without any treatment, life expectancy is about 77 years. Overview. We now know that there are two strands of hemophilia, A and B. We know the function of hemophilia, that being the lack of blood clotting resulting in excessive bleeding. We know that men tend to have it more than women, but the risk is still very severe, especially when in surgery, on menstruation cycle, or when blood is exposed in general. A more internal risk is internal organ damage. However, treatments are necessary depending on severity of the patient's condition.